welcome to Growing Beyond Failure. This is Mentor Moments with Dr. Ahan Hunter. Today's topic is going to be about being an OBGYN, why I'm a guy in a women's health field, what this all means, and sort of why I think a lot more people should decide to go into this as a field as a whole. Please like, subscribe, follow on all platforms, YouTube, Instagram, and even TikTok. I do a lot of different things on TikTok, all the same name, Dr. Ahan Hunter. And so just appreciate all the love and all the support. If you have any comments, questions, anything you would like to hear, see, let me know. Send me a direct message through any of those channels, and I'd love to hear from you all. So let's get rocking and rolling. First things first, what I do is I am an obstetrician gynecologist. So what I do is I take care of not only pregnant women, but also women of all shapes, sizes, and ages. So from, I think my youngest patient I've ever taken care of since I've been out of training is 14, and the oldest patient I've ever taken care of, I think it was 93. So I take care of a lot of different women. Don't take care of any men per se. Now, if you are a transgender man born with female genitalia and decided to become transgender, I do take care of some of those patients too. But just as a whole, I'm a sort of a women's health physician. And what I do on a daily basis really depends on, and what an OBGYN does on a daily basis really depends on what you sort of want it to be. Part of my story I told in the first episode of this podcast is that what I wanted to do was I wanted to affect change in medicine. And when I was in medical school, I thought OBGYN was the last thing I wanted to do. And then I ended up doing my rotations and then found out that I absolutely love women's health. I love bringing new life into the world. I love being there. I love the highs and the lows of the field. There's something about being with people in the midst of the happiest moments of their life and in the midst of the saddest moments of their life, and trying to bring happiness in spite of all of that. And that's sort of why I decided to go into this in a nutshell. I, as a guy in women's health field, get a lot of flack on social media, not in real life, but more in social media, about how men should never tell women what to do with their bodies. And that's not the take I go with. For me, my goal is just to help support women of all shapes and sizes and who come from all backgrounds. And that's just my job on a daily basis. That's what I get paid to do, is to help women choose the decisions they want to make for themselves, for their families, for their own bodies. And that's what I do on a daily basis. I strongly stand by that wholeheartedly. I really, truly, honestly believe that part of my job is not only to educate, but to empower. And so that's what I do. And being a guy in the field, to me, it shouldn't matter what my look is. I think all that should matter is the drive that I have for the field and how much I want to make change in women's health as a whole. And I think that to look at me on face value as being a man or a woman or non-binary or any of those distinctive features, that I think takes away from what I've worked towards my entire life, my entire adult life, which is to get to where I am now. And I'm not where I want to be, but I'm still striving for that. And so, my goal here is to help empower those who are trying to figure out, should they become an OBGYN? How do I do it? What does it look like? Like, I'm trying to tell you, do it, because you'll never regret it, in my opinion. It's a fantastic field. It has its highs and its lows, but it's absolutely amazing. One of the big things that comes with being an OB is trying to figure out what kind you want to be. So when I did training, there's 4 years of residency is what it's called. And I was training both obstetrics and gynecology. So some that come out of residency, out of training, can decide to only do one or the other of those things. Some people only decide to work with pregnant moms only, and some people only decide to work with non-pregnant women only. And either one, I think, is totally okay. I'm what you call a full scope OBGYN, so I work with all, but that's not for everybody. Some don't want to be a full scope OBGYN because of the lifestyle. I will tell you, I have 3 children, and different phases of their life. Teenager, a almost third grader, and an almost 3-year-old child as of today's recording. And am I home every single day with my children? No, not every single day. I do take call, and I'll tell you about what my call looks like in a second, but I'm there for my kids. I have the ability to change my schedule in a way to make time. If my kids have something going on and I really want to make it, I can arrange my schedule in a way to where I can make that. We just went on a family trip with 15 of our family members, including all of my children. And I was there for a week and I was able to be there. Totally 100% there, not working. I only worked when I wanted to, when there was downtime and everyone was doing something else. But otherwise, like, I could do what I wanted to do. And so that's, to me, the beauty of the field of not only being a physician, but being an OBGYN. One of the things many people are afraid of is call. So call looks different depending on where you work. So when you're trying to figure out what you want to do as an OBGYN and you're trying to choose what job you want to be, call is very important. Where I work, we take call during the week, so a 12-hour shift, either day or night, and then we also take call on the weekend. Some people take call where they cover the entire weekend and they take call from home, meaning you're at your house and you get a phone call and you kind of can decide, do you need to come into the hospital or not, or can it be managed over the phone? What I do is I take what's called in-house call, which is I'm in the hospital the entire time of my call shift and I'm just there the entire time. I personally prefer that because I just want to be there and not have to be in the middle of something. Like, my son loves Legos, so like in the middle of building Legos with my son and I get a phone call, I have to get up and go. Like, to me, I don't love that. I rather just, when I'm home, I'm home, and when I'm at work, I'm at work. And that's how I like to divide it. Everyone is not the same, so a little different for others, but that's just me. So my call on the weekend is we do 24-hour call. So either 24-hour shift on a Saturday or 24-hour shift on Sunday. That does not mean that I'm awake for all 24 hours. Have there been shifts where I have been awake for the entirety of that time? Yes, but for the most part, I do get some sleep. Some meaning anywhere from 1 hour to 8 hours of sleep during that 24-hour time frame. And some people say, oh my gosh, that's so crazy. And it's all in what you choose. When I decided to become an OBGYN, I knew what was most important for me and what's important for my family. And my wife and I are constantly in conversation on what we think is most important, what we need for our family and our lifestyle. And so that's what we are constantly working on. And if there are changes to be had, changes to the call schedule, changes to, hiring, firing certain people at my job and trying to figure out how to lighten the load and different suggestions. Like, I talk with my wife about these things ahead of time. So we're sort of in lockstep about what the plan is and what my schedule is going to look like. We also are in lockstep together because we have children. So my wife works a lighter schedule than I do because of this call schedule. And we want at least one of us to be home a lot to be able to be there for our children. So that's what we decided to do. Again, not for everybody. Everyone's not the exact same. Some people don't have kids. Some people may have what I call dog pets, and that's fine too. But, I think that as a whole, the field itself is very vast, and you can do a lot of things within it. Within saying that, you can do a lot of things within the field of OBGYN without needing any extra training to do such a thing. For instance, I said earlier, when people come out of residency or training, you can do just obstetrics or just work with pregnant women, or you can just work with just non-pregnant GYN only women. And to just work and just deliver pregnant women, that's called a hospitalist. So hospitalists do these shifts, and they usually do about 12 shifts a month. And there are 12-hour shifts a month, meaning you can do 6 24-hour days, or you can do 12 12-hour days. Depends on how you want to divide your schedule. And so that's amongst the entire month. So if you do 12-hour days, let's say you divide the month, 28 days in the month, it's really 30, but let's go with 28 for February. So essentially 16 days out of that month you have to yourself. You can do whatever you want with it. And so that's why some people choose to be hospitalists, because there is that ability to make more money, because hospitalists do make more than full scope OBGYN. So you can make a little bit more money and you have a little bit more lifestyle. On the flip side of that, the downside of being a hospitalist is your GYN numbers, meaning your ability to do surgery, are going to be lower because you're going to be focused more on the pregnancy side, less on hysterectomy, myomectomy, taking out fibroids, less on just like GYN surgery. So your GYN surgery skills will be lacking because you won't be doing that as much. If you go on the other side of things, just GYN only, it's a little bit different. So you don't really have as much call, right? Because you're not taking call to cover labor and delivery. So now call is much lighter. It's only going in if you need to in the middle of the night to do a GYN surgery, which is rare. It doesn't happen very often. And usually the hospitalist, so the person on call in the hospital, can handle that. So call load for a GYN only person is a lot less. Now what comes with that too is a deduction in pay. So you don't get paid as much because you're not in the hospital, delivering babies, and you're more so in clinic, seeing a lot of people, doing a lot of annuals, seeing a lot of GYN problems, less of the pregnant woman, if that makes sense. And so, that's the flip side of, what you want to do. And there are some people who are primarily in clinic and don't do a lot of GYN surgeries. So they do a lot of minor surgeries, hysteroscopy, where you look inside the uterus with a camera and you can do various procedures through that, is sort of their main bread and butter. And there's some people who make a living just doing that by itself. And, when I talk income, I'm talking more of those who are trying to decide what you want to do and how you want to decide what part of OBGYN to go into. This is what I mean. I'm speaking more to those folks, less to the lay people who are just listening this just to listen. But I do think that that's something to know, and that's an option where you don't have to do any extra training at all to do. You can, and as you go in your career, you can decide to go all in towards obstetrics, or you can go all in towards GYN, and that's totally okay, completely fine to do. Again, no extra training necessary. And that's the beauty of the field, is that you can make those changes throughout your career, and there's not much that you have to do per se to make those changes. The only thing that changes when you go to GYN only is many people drop their liability insurance for obstetrics because now you're not delivering babies anymore. So then that kind of goes away. But otherwise, you can make that change yourself. Now, the one thing I didn't talk about is who is your employer, or if you're self-employed. So if you are self-employed, you can make that decision at any time in your life. It's totally fine because you're your own boss and you can decide that. If you have an employer, sometimes your employer will not allow you to do such a thing. And if they do, it comes with strings. So make sure you look into what those strings are if you decide to pull one way or the other, and what comes with that. And that's something to talk with your job about if you think at any point in time that's something you want to do. The other thing I would say is, if you want to become more subspecialized in the field of OBGYN, that does involve more training, usually 3 to 4 more years of training. And that's anywhere between MFM, or high risk OB provider, who only sees generally pregnant women. Sometimes you'll see some women for what you call preconception counseling. So those ladies who have complicated medical history, complicated birth history, trauma during birth, and you need sort of a specialist opinion on what should change the next time you decide to get pregnant. So that's the non-pregnant side of it. But otherwise, you're seeing predominantly pregnant women. That's a thing you can do. There's urogynecology, where you're taking care of a lot of women who deal with prolapse, meaning parts of the vagina are weakened and now you feel like something is coming out, or you feel a bulge, or you're leaking. So urinary incontinence, leaking urine, like leaking urine when you laugh, cough, sneeze, or excuse me, you can have stool incontinence, where you are leaking stool anytime because of weak muscles in your pelvis. So that is a specialty amongst itself. And you could become a GYN cancer doctor, where you not only do surgeries to take out cancers and do other complicated GYN surgeries, but also you can give and administer your own chemotherapy. And so those are very complex fields that require a lot more training. So OBGYN training is 4 years by itself. And then if you want to do those other training, like I said, it's 3 to 4 years generally. There's also minimally invasive surgery. So it's another field where you can be trained specifically on GYN surgeries. That is usually 2 to 3 years, or family planning, where you learn more about not only abortion care, but more about how to take care of women who are miscarrying, how to take care of very complicated abnormal pregnancies. And if a woman decides that she doesn't want to move forward said pregnancy, or feels as though it will be traumatizing to her to have a non-viable pregnancy go to full term, family planning providers are the ones that you would turn to help figure out how to navigate that situation. But they also deal a lot with birth control and how complex birth control can be, not just pills, but Depo-Provera, IUD, Nexplanon, the NuvaRing, the patch. Like they know birth control backwards and forwards. And so that's another expertise that you can take amongst OBGYN. And there's other things you can do too that are out there. I've seen ICU, ICU providers is one of the things that's out there. It's usually more in, like, I think the fellowships in Arizona is what I've seen. But there are things, coming up. But those are the main ones. And then there's, forgetting one. Oh, excuse me, pediatrics and peds and adolescent OBGYN, where you're really taking care of a lot of younger women who are, have a lot of different issues. Some of it being, early diagnosed endometriosis, some of it being having some sort of bleeding disorder. And what do? And how do you put them on birth control to help them not be anemic all the time and bleed heavy? And, it's very convoluted, a lot of different things, things called Mullerian anomalies, where people are born with, the structures aren't exactly fully formed. And so now there's deformities there. And so how do you navigate that situation? So they're the ones who you would go to. But regardless, there's a lot of different avenues and places you can take as far as going into it. And one of the other things I'll say is that, this field as a whole to me is very rewarding. Again, the highs, the lows, and everything in between, extremely rewarding. I love what I do, and I think you have to love this to do it for a long time. You really have to be in love with the field and what comes with it to do this. There are a lot of lay people who believe that OBGYN providers, especially those who take care of pregnant women, are doing this for either money or doing it for various other reasons, nefarious reasons. But I would argue that to be an OBGYN is probably one of the hardest things you can do, because every other provider in medicine calls upon you whenever they're dealing with a pregnant woman, because many people have no clue what to do for them. And so you look to your OBGYN to help you. We don't get compensated as much as our peers amongst other physicians. I'm not complaining. I make 6 figures, so I'm not complaining at all. But when you compare amongst physicians, even reimbursement rates, there's a huge lobby right now to change the reimbursement rates, because if you look at procedures for men compared to women, women get reimbursed, their procedures get reimbursed less than procedures for men. And I think that's insane and just ridiculous. But this is sort of women's health. This is kind of what's been here. I think that women have been put on the back burner for many, many, many years and not been believed when it comes to pain, not been taken care of when it comes to taking care of their complaints. And so I think that we need providers who care and who love the field to help take care of women, to help women not only who are pregnant, but also there's a huge push now to take care of women in menopause, because menopause will affect 100% of women. And to not have training and providers who feel comfortable in that, I think is a problem. And so, I can go on and on and on, but ultimately it's my favorite field, of course, because it's what I do. But I'm super biased. And I think, every time I encounter a medical student, I really want to impress upon them that the negative connotation that comes with OBGYNs, that you are constantly busy, you can't have a family, you can't enjoy life, and your life will be miserable, I think is absolutely hogwash. And I would argue against it 10 out of 10 times. I thoroughly enjoy my life. I have a family. I see my family. I enjoy my job. I love what I do on a daily basis. And if I had to go back, Lord, I would never want to go back to med school again. But if I had to go back and choose again, I would choose this field 10 out of 10 times because it's just my calling. I think I've been called to do this. And so, my goal in all this is to help inspire others to choose this field, to do it, especially people of color, to do this because there aren't enough of us. There's only, amongst all OBGYNs, less than 5% are African American, and of all OBGYNs, less than 2% are black males. And so, there's a deficiency. And I think that kids need to see people that look like them when it comes to inspiring them to do great things. And so that's my goal. That's what I want to do. That's why I named the podcast Mentor Moments, because I want to be a mentor for those who don't know what to do. So thank you guys again for listening. Please like, subscribe, share again. This is Dr. Ahan Hunter, Mentor Moments, Growing Beyond Failure. Thank you all so much. I really, truly appreciate it.